Committee will come to order. Good afternoon and welcome to today's hearing. Today our committee is honored to welcome our good friend and former colleague Dr. Tom Price to testify on President Trump's fiscal year 2018 budget proposal for the Department of Health and Human Services. Mr. Secretary, thank you for being here and a warm welcome back. Thank you. Look forward to your testimony. As a former member of this committee for over 6 years, you've been closely involved with our efforts to improve the health care and welfare programs under our jurisdiction. Your work and leadership on this committee helped set the stage for many of the crucial reforms we're pursuing today. Already this year, we're moving forward with solutions to repeal Obamacare, which continues to hurt millions of Americans, and enact step-by-step reforms to return patient-centered health care to the American people. We're taking action on welfare reforms that will help more Americans move out of poverty and up the economic ladder. In building off the historic Medicare payment reforms enacted last Congress, we're working to improve choice, affordability, and quality in Medicare for current and future beneficiaries. We're pleased to see many of these priorities reflected in President Trump's fiscal year 2018 budget proposals for the Department of Health and Human Services. For example, the President's budget makes important strides to reduce inefficient and wasteful spending. It reflects our efforts to repeal and replace Obamacare. It removes burdensome regulations harming the doctor-patient relationship. And the budget expects all those who can work to work, which is the surest way to economic independence, while prioritizing federal resources to provide real help to those most in need. Although more must be done to preserve and strengthen Medicare for the long term, the President's budget reflects a meaningful step toward improving America's health care system. Today, we're eager to explore ways we can work with President Trump and with Secretary Price to advance solutions that will improve the lives of all Americans. When it comes to health care, we know that true patient-centered reform is urgently needed. Obamacare is imploding as we speak. Premiums and out-of-pocket costs are skyrocketing. Choices are disappearing rapidly. And with the House passage of the American Health Care Act, we've taken a critical first step in our multi-phase effort to repeal and replace Obamacare. But we all know there's more work to be done. To carefully uproot the law and restore patient-centered care, it will take sustained, coordinated effort from Congress, the White House, and HHS. In the immediate term, I want to make this key point. In the immediate term, action must be taken to stabilize the individual insurance market and protect Americans from the consequences of Obamacare's collapse. We must work together to provide the certainty and appropriate resources to protect low-income Americans who've been forced to rely on Obamacare's deteriorating exchanges. Obamacare forced millions of Americans into a poorly designed government-run marketplace, and now plans are disappearing in Texas throughout the country, leaving many low-income families with few, if any, places to turn for coverage. Obamacare's design flaws were not the fault of the American people. People now trapped in Obamacare did what the government mandated them to do. They complied with the law. They should not be left out to dry. And I think a particularly timely point today, as the Senate considers the AHCA, we must work together to deliver an expedited solution to help stabilize the insurance market and help lower premiums for Americans trapped in Obamacare today. We should act within our constitutional authority now to temporarily and legally fund cost-sharing reduction payments as we move away from Obamacare and toward a patient-centered system that truly works for the American people. Insurers have made clear the lack of certainty is causing 2018 proposed premiums to rise significantly, and when these payments are funded by Congress, families trapped in Obamacare should expect these proposed premiums to be reduced significantly. And when it comes to our nation's welfare system, it's clear our anti-poverty programs aren't delivering positive results for the American people. We've not seen major progress in moving families forward, despite spending hundreds of billions of dollars every year. We can and must do better, and it all starts with a simple and powerful principle: the best anti-poverty program is a job. We have to emphasize work in exchange for welfare benefits. We must focus on positive outcomes. And we have to ensure that taxpayer funds are directed to evidence-based programs that truly deliver results for Americans in need. The current challenges we face in healthcare and welfare cannot be solved with the top-down, Washington-knows-best approach. That model has failed the American people time and time again over the past 8 years. It's time to go a new direction, one where workers, families, job creators, and states are in the driver's seat. And more important, it's time to get our economy moving again. Mr. Secretary, we're committed to working with you, with President Trump, and with the Trump administration to accomplish these crucial goals. And with today's conversation, we can continue moving forward together on solutions to improve the lives of all Americans. Again, Mr. Secretary, we're grateful for your time. We look forward to your testimony. I'll now yield to the distinguished ranking member, Mr. Neal, for the purposes of an opening statement.
Thank you, Mr. Chairman. Mr. Secretary, delighted you're here. This is a homecoming for you, and we're happy to have you with us this afternoon. I understand how valuable the Secretary's time is, Mr. Chairman, so I hope that you're going to give members the latitude to talk about pertinent matters because of the fact that our questioning will be diminished to 3 minutes per question. So I understand the Secretary's time, but I hope that that will allow our members on this side who would like to probe some of the positions that the administration has offered sufficient opportunity to get that accomplished. I want the American people to understand this afternoon the impact of the HHS budget before us today. It cuts so many programs on which middle-class families rely that I could go on well over allotted time if I described all of them. It goes against every promise that President Trump made during the campaign and would cut programs that help middle-class families, both young and old, across the United States. For example, cuts to Medicaid would put at great health risk children, long-term care for seniors, and individuals who rely on mental health and opiate addiction programs. Medicaid is now the largest source of funding in the United States for substance abuse treatment, and I'm sure everyone in this room knows somebody who's facing an addiction crisis. The New York Times recently reported that, based on preliminary data that they compiled, that drug overdose deaths in the United States will likely exceed 59,000 that occurred in 2016, the largest annual jump in our nation's history. It's estimated that 19% that number will rise by since 2015, and likely to get even worse this year and next. In addition to hardworking families, the cuts would harm hospitals because they would take on significant uncompensated care, but with lower reimbursement rates. This is a recipe for health and economic disaster, not just for Medicaid, but for all Americans. Not only would patients receive lower quality care, the cuts would create a devastating economic ripple affecting communities and likely lead to significant job losses. We're all reminded today that for most communities across the country, including mine, that our hospitals are now the largest employers. The reality is that Medicaid is now a middle-class benefit. As more Americans celebrate living longer, new challenges have appeared: dementia and the general need for long-term care. We need to ensure that these programs are secure in the future to keep up with the strides that we're making to extend life expectancy. Thanks to Medicaid, in Massachusetts, almost 100% of the children and 97% of adults have health insurance. It is clearly popular amongst the citizenry of the state. I remind my colleagues on the other side that Americans may not remember who brought them higher quality, lower cost health care, but they certainly will remember who took it away. Proposals to convert Medicaid to a block grant or per capita cap would shift costs to the states. I come from local government. You know exactly where those funds would end up to balance the budget of something that's not even remotely related to health care. Proposed Medicare cuts are staggering, $33.5 billion at a time when millions of baby boomers are beginning to rely upon this critical program. We have a bipartisan responsibility to govern on behalf of the middle class and grow our economy, especially to avoid any self-inflicted damages. America's seniors earned their Medicare benefits, and I hope the Secretary will commit to working with Congress to make sure that Medicare and all of our obligations are paid on time and in full. Mr. Secretary, because you are a trustee of both Medicare and Social Security, I know you want to make sure in this budget that we would not cut Social Security by the proposed $64 billion that has been offered over 10 years. And what's worse, these cuts are targeted toward people with severe disabilities. Medicare, Medicaid, and Social Security are now all linked Because of these programs, your parents aren't living in your attic. Other critical programs in our jurisdiction that face cuts include the Social Services Block Grant and temporary assistance for needy families. The programs provide services that directly benefit vulnerable children, seniors, and disabled Americans. Let me conclude by addressing a recent decision by health insurance companies to leave the market. As HHS Secretary, the healthcare world looks to you for leadership. And to date, the new administration has not provided that unwavering leadership for the healthcare system that we have witnessed in terms of the destabilized health insurance market. I'm referring to cost-sharing reduction subsidies. The President has toyed with whether he intends to keep them or not, and you and I both know that one reason for the premium increases and market instability recently reported in the press is because of that very issue. Table 25.1 of the Analytical Perspectives has a clear line indicating that the budget assumes payments will go forward under current law. Why the President continues to offer confusion is unclear. We will surely disagree. In spite of your budget, there's room for us to come to conclusions that will be supportive of the American people. For leadership purposes, I urge you and the President to make a decision one way or another and then stick to it. The confusion in the marketplace is not helpful. This budget would force middle-class Americans to pay more for less health care, strip down critical addiction rehabilitation services, create further chaos in health insurance markets, and devastate programs for families that need them in an effort to make their ends meet. And with that, I yield back my time.
Thank you, Mr. Neal. Today's sole witness is Dr. Tom Price, Secretary of the U.S. Department of Health and Human Services Committee. As you know, has received your written statement. It'll be made part of the formal hearing record, and we've reserved 5 minutes to deliver your oral remarks. Secretary Price, welcome again. You may begin when you're ready.
Thank you so much, Mr. Chairman, Ranking Member Neal, and members of the committee. I want to thank you for inviting me here today to discuss the President's budget for the Department of Health and Human Services for fiscal year 2018. It really is an honor to be back in the committee. Whenever a budget is released in this town, the most common question is asked, how much? How much money does the budget spend on this program, or how much does it reduce from another program? And as a former member of Congress, I understand the importance of this question, but too often it's treated as the only question worth asking about a budget, as if how much money a program spends is more important than, or somehow more indicative of, whether the program actually works. President Trump's budget requests does not confuse government spending with government success. The President understands that setting a budget is about more than establishing top-line spending levels. Done properly, the budget process is an exercise in reforming our federal programs to make sure that they do their job and use tax dollars wisely. The problem with many of our federal programs is not that they are too expensive or that they're too underfunded. The problem is that many of them simply don't work. Fixing a broken government program requires redesigning its structure and refocusing taxpayer resources to better serve those most in need. And that's exactly what President Trump's budget will do at HHS. Consider Medicaid, the primary source of medical coverage for millions of low-income American families and seniors facing health challenges. If the amount of government spending were truly a measure of success, Medicaid would be hailed as one of the most successful programs in the history of the country. 20 years ago, annual spending on Medicaid was less than $200 billion. Within the next decade, it's estimated that it will top $1 trillion a year. Despite these significant investments, 1/3 of physicians who ought to be seeing Medicaid patients are not. And some research shows that enrolling in Medicaid doesn't necessarily improve health outcomes for the newly eligible Medicaid population. This suggests that we need structural reforms that empower states to serve their unique Medicaid populations in ways that are both compassionate and sustainable. Under current federal law, rules prevent states from focusing on their most vulnerable communities and from testing new ideas to improve health outcomes and access to care. This budget changes that. Now, HHS's mission of protecting the health of the American people involves far more than overseeing the nation's health care and insurance systems. Health and Human Services is the world's leader in helping the healthcare sector prepare for cyber threats and responding to and protecting against public health emergencies. Recently, I witnessed this important work firsthand while visiting with Ebola survivors in Liberia and representing the United States at the G20 Health Ministerial Meeting in Berlin and the World Health Assembly in Geneva. To support HHS's unique federal role in public health emergency preparedness and response, the President's budget provides $4.3 billion for disaster services coordination and response planning, biodefense and emerging infectious disease research, and development and stockpiling the critical medical countermeasures. In addition, today America faces a new set of public health crises that we've been far less successful in resolving. Those are severe mental illness, opioid crisis, and childhood obesity. And as Secretary, I am committing to leading HHS to address each of these three challenges. And the President's budget calls for investments and policy reforms that will enable us to do just that. The budget calls for investments in high-priority mental health initiatives for psychiatric care, suicide and homelessness prevention, and children's mental health, focusing especially on those suffering from serious mental illness. In 2015, over 52,000 Americans died of overdose. This budget calls for $811 million to support the Department's five-part strategy to address this epidemic. To invest in the health of the next generation and help the nearly 20% of school-aged children who are obese, we want to help them lead healthy and happy lives. The President's budget establishes a new $500 million American Health Block Grant. Additionally, the President's budget prioritizes women's health programs by investing in research to improve health outcomes for women and increasing funding for the Maternal and Child Health Block Grant and Healthy Start. Across HHS, funding is maintained for many vital program services for women, including community health centers and domestic violence programs and women's cancer screenings and support, mother and infant programs, and the Office of Women's Health. This budget demands tough choices, yes. And in this challenging physical environment, there are no easy answers. With this budget, the new administration charts a path toward a sustainable fiscal future and ensures the dedicated resources provided enhance and protect the health and well-being of the American people. Mr. Chairman, I'm honored to be with you today, and I look forward to your questions, and it really is a great privilege and honor to be back with the committee.
Well, thank you, Mr. Secretary, for your excellent testimony. We'll now proceed to the question-and-answer session. I'll begin. So during your time on the committee, you were well aware of our ongoing investigation in the Obama administration's illegal funding of the Affordable Care Act's cost-sharing reduction payments. Are you able to comment on the ongoing litigation between the House and the administration regarding these unfunded payments?
Well, Mr. Chairman, as you and the members of the committee know, that once you assume this role, the court challenge changed from House v. Burwell to House v. Price. So as the defendant in this case, I'm limited in what I can say. What I can say, however, is that the budget reflects the payment of the CSR payments for the next 2 years.
Great, thank you. That was, I think, the point here. I think the improper and illegal way in which the Obama administration financed these payments fuels continued uncertainty for Americans across the country. And they're just asking, will there be health plans left to buy my town? If so, can I even afford it? Clearly, congressional Republicans are committed, as you are, to a smooth transition away from Obamacare's failures and toward patient-centered care. And that includes, as you point out, legally funding these payments for a short period of time, consistent with their scheduled repeal in the American Health Care Act. This will increase market stability and provide relief for Americans who've seen their premiums double under Obamacare and for too long have been whipsawed between the laws of forced plan cancellations and its punitive individual mandate. The Senate is expected to take up the health care plan soon. That lowers premiums, cuts taxes, reduces the deficits. This summer is a critical one for insurer participation. So from your view, can you tell us what other proposals are included in this budget to shore up the damage caused by Obamacare and help lower premiums this year and next for those who are trapped in the current law?
Well, I think, thank you, Mr. Chairman. I think it's important to think about this in terms of principles. And if you think about accessibility to health care, there are 20 million Americans right now who don't have health coverage. About 6 million of those have said they'll accept the penalty. Another 14 million or so took a waiver. Those are folks for whom the health coverage that's available out there doesn't suit them. So we believe, as I know you do, that it's important to provide the opportunity for individuals to get the kind of coverage that they want, not that the government forces them to buy. And so whatever reform comes about needs to be able to accommodate that and give an array of options and choices for individuals. In terms of affordability, so many of the things that were put in place with the law, we believe, have made it that much more difficult for individuals to be able to afford the coverage that is available. You've seen the prices skyrocket. The premiums have gone up over 100% on average over the last 4 years across the country. Many states, 3 states, have had over triple the premiums. And then the deductibles have increased to such a point where there's so many folks out there who have coverage, but they don't have care because they can't afford the deductible. So again, we believe it's incredibly important to provide for folks to have the kind of coverage that they want, that they can afford, yes, but that also provides them the care. And then so many of the kinds of things that empower patients, whether it's through choices or whether it's through the ability to select their physician and the like, making it so that patients and families and doctors are making these decisions and not Washington, D.C. Those are the principles that we hope we can adhere to.
Right. Thank you, Dr. Price. And just to conclude, so the President's budget does include legally funding these payments for a short period of time for the cost-sharing reduction consistent with the scheduled repeal under the American Health Care Act.
That's reflected in the budget.
Yes, sir. Thank you very much. I'll now recognize the distinguished ranking member, Mr. Neal, for any questions he may have.
Thank you, Mr. Chairman. Mr. Secretary, as you know, opiate addiction is raging throughout many of our communities across the country. In my state of Massachusetts has one of the highest rates of drug overdose deaths in the country during 2015. As the epidemic continues to ravage communities across the Commonwealth, we're recognizing this as a national problem. Medicaid remains the biggest payer for substance use disorder treatment. Fortunately, Massachusetts expanded Medicaid under the Affordable Care Act, so many people who are struggling with addiction have access to these services through the state's Medicaid program. The President's budget and the House-passed health care bill slashed Medicaid funding by $1.4 trillion and would undoubtedly lead to cuts in substance use disorder treatment and coverage for Americans struggling with substance use disorders, including opiate addiction. The budget compounds the problem by also eliminating millions of dollars in social service block grant funding dedicated to substance abuse treatment. I would urge you to reconsider these cuts that will put the states in a terrible position by choosing between care for the elderly, working families, people with disabilities, and individuals with substance abuse disorders like opiate addiction. These are incredibly important services for our constituents, and the cuts you propose would make the devastation of this epidemic far worse. The second issue I'd like to raise is the level of funding for marketplace research and enrollment in the President's budget. As you know, we've made historic progress in lowering the uninsured rate in recent years, with just 9% of the American people uninsured in 2016. The ACA, built upon the experience we have had in Massachusetts, passed with the help of Governor Romney, creating a marketplace to purchase private insurance and expand Medicaid coverage. None of that came easy. Massachusetts worked tirelessly to enroll people in coverage, even working with our beloved sports teams to encourage people to sign up. Today, over 10 years since our reform passed, we've seen the fruits of the investment, with 97% of our non-elderly adults insured and 99% of children covered. The department you now lead has worked with stakeholders from all levels of government in both parties to faithfully implement the law and ensure that Americans know what coverage options are available to them. With each passing year, we've gotten smarter, more data-driven, and more effective. This all requires funding and partnership from the highest levels of government. Unfortunately, the President's budget slashes funding for the federal marketplace and targets outreach and enrollment specifically. Under the fiscal year 2018 budget, you propose to cut funding for federal marketplace by 35% from last year's level, including outreach and enrollment. I hope you'll reconsider these proposals. We've made much progress thanks to the efforts of community groups and dedicated public servants across the country. Pulling funding for their efforts will now undoubtedly lead to significant increases in the uninsured rate, and many American families would go without coverage and the care they need to help make ends meet. Lastly, Mr. Secretary, Treasury Secretary Mnuchin has warned us that if Congress does not raise the debt limit before the August recess, we run the risk of a first-ever default on the full faith and credit of the United States. For that reason, privately with me and publicly in front of the Congress, he has suggested as much, and he has urged us to act quickly on a clean debt limit increase. If we fail to act, we will have a devastating effect on the economy at home and internationally, since credit markets around the world rely upon the confidence that the U.S. Treasury bond is still the safest investment on earth. As Social Security and Medicare trustee, you must be especially aware that if we don't raise the debt limit, the Trump administration would be the first in history to fail to pay the earned Medicare and Social Security benefits. Mr. Secretary, will you join Secretary Mnuchin in supporting a clean debt limit increase?
I support the Secretary's statement.
Thank you, Mr. Chairman.
Thank you, Mr. Neal. Members will be advised due to scheduling constraints, questions will be limited to 3 minutes. With that, I recognize Mr. Nunes.
Thank you, Mr. Chairman. Welcome back, Mr. Secretary. It's great to see you. I briefly want to discuss the American Health Care Act that recently passed out of the House of Representatives and now sits awaiting action in the Senate. There has been a lot of discussion about insurance companies denying coverage based on pre-existing conditions. Now, from my perspective, that is not allowed in the bill that passed the United States Congress. And I know my state of California would likely never allow for a waiver, but can you quickly confirm that even in a waiver state, insurance companies will not be allowed to deny coverage? And I'll give you a chance to expand on that if you would like, Mr. Secretary.
Absolutely. The need to make certain that individuals with pre-existing illnesses and injuries are able to gain coverage is an absolute priority for the President and for our department. And I believe that the bill that passed the House accommodates for that and makes certain that individuals with pre-existing conditions are able to get coverage.
So just so we can be perfectly clear, there is nothing in the law that would allow for, or not the law, but the bill that awaits action in the Senate that would deny coverage for pre-existing conditions.
In fact, on the contrary, I think there's a section or a paragraph that stipulates specifically that coverage cannot be denied based upon a pre-existing condition.
Thank you very much, Mr. Secretary. I'd like to turn my attention to the new health care bill, and I want to talk about the merits of the plan. I don't think many people have really talked about the merits of the plan, and that is that if you don't have health care from the government or you don't have health care from your employer, you will be allowed a tax credit to purchase health care. And some people, not only here in Washington, but others have stated that, well, even if you give people these credits to use to go out and buy health care coverage, I've heard things like, well, no one would go and buy coverage. I've even heard people say, well, how are people that don't speak English going to go and buy coverage? How are kids going to go buy coverage? I tend to disagree that just because someone doesn't have a college degree or may not speak English very well, may not be their first language, I tend to disagree that those people are too stupid to be able to use somewhere between $2,000 up to $14,000 for their family to go buy coverage. And Mr. Secretary, in just the closing seconds that I have, if you could comment on the Americans' ability to use those credits.
Well, we have great confidence that if we put in place a system that provides for and allows for coverage that the American people want, that they will be able to purchase that coverage.
Thank you, Mr. Secretary. Great to see you.
Thank you.
Thank you. Mr. Levin, you're recognized.
I wasn't going to talk about your statement about pre-existing conditions, but the impact of waivers would mean that people with pre-existing conditions, if waivers were granted, would not be able to afford care. I hope others will bring that up. You said in your statement the following: the real problem is that federal programs do not work. They fail the very people they are meant to help. In the budget, there's a proposal to reduce funding for NIH. I want to enter into the record a chart that shows how the budget in real dollar terms has dropped from $40 billion in 2003 to $34 billion this year, and now there's another proposed $6 billion cut. Mr. Secretary, I checked recently, and I want to refer to 4 breakthroughs in recent times because of NIH funding. Hepatitis C, there's now 100% treatment. Cystic fibrosis, they have found the gene through the NIH research, and they're on a path to have it become a chronic disease. AIDS funding has dramatically changed that disease. And then cancer, there's remarkable breakthroughs in immunology. I hope you will take another look at this drastic proposal to cut NIH funding another $6 billion. I won't ask you now. I'm afraid you might defend the budget cut. I hope in good conscience with your experience, you'll work to make sure it never happens. Those breakthroughs show programs are helping human beings and saving lives. Let me just ask you on cost sharing, are you willing now to commit that the administration will provide the monies that are now provided for cost sharing in future years?
As I mentioned before, Congressman, as a defendant in the suit, I'm not able to say for legal reasons anything more than the budget accommodates and reflects the CSR payments.
Okay, the budget does, but forget the legal case. Are you willing to say, I know it's in the budget, that the monies will be provided for cost sharing? Yes or no?
So the monies are provided through Congress. No monies can be expended from the public treasury except through a provision from Congress. So you all provide the monies.
The monies now aren't being provided that way, sir.
All time has expired. Mr. T-Berry, you're recognized.
Thank you, Mr. Chairman. Thank you, Doc, for being here. We miss you.
Good to see you.
So this morning, we held in this room a Joint Economic Committee hearing on the opioid crisis in America, and my state of Ohio has been particularly hit hard by this devastation that's spread across families, communities of all types. Our Ohio Attorney General, Mike DeWine, testified that last year, or 2015, there were 4,169 Ohioans who died of accidental overdose, and that was a 36% increase from the year before. So I know you and the President believe this is a priority. This is not just the federal government's responsibility, as Attorney General DeWine said. This is a multi-pronged approach with local communities having to take the lead. But I know this is important to you and important to the President. Can you talk about your priorities on this issue?
Well, thanks, Mr. T-Berry. This is an absolute priority of the President, and it's an absolute priority of mine as Secretary in the Department. The numbers are just staggering, as you well know, and Ohio's challenge is America's challenge. 52,000 overdose deaths in 2015, 33,000 of those from opioids, and the numbers are only going up in 2016 and this year as well. We've put forward at the Department a five-point strategy to make certain that we have the highest level of recovery and treatment opportunities for folks, to make certain that we've got overdose reversing drugs available as broadly as possible all across this nation. I visited Southwest Ohio in a community there that's doing incredible work to stem that tide. We need better data, public health surveillance. We need better data to figure out not just what's happening, why it's happening, why are we seeing this remarkable increase, incredible increase of the scourge of opioid addiction. And we also ought to be able to marry the data from the criminal justice system where the drugs are, so that we are able to respond to the medical challenges that we'll have. Further, we need to make certain, as Mr. Levin said, that we're doing the kind of research, especially in this area. There are exciting new advances that are possible. The possibility through NIH working currently on a vaccine for addiction. Imagine that kind of incredible opportunity for folks that are imprisoned by this addiction. And then finally, fifth, the whole issue of pain management. How do we handle pain treatment in this nation? And I would suggest to you that some federal policies have, in fact, provided incentives to have us move in the wrong direction, to provide more availability of opioids than fewer. And so it's an absolute priority. I'm proud of the President's leadership on this, and I look forward to turning that curve in the right direction, which is downward.
Thanks for your leadership. I yield back, Mr. Chairman.
Thank you.
Thank you. Mr. Lewis, you're recognized. Thank you, Mr. Secretary. Can you grab that microphone?
Thank you, Mr. Secretary, for being here. Mr. Secretary, during my years in Congress, I learned that supporters of a budget are often inclined to refer to it as a blueprint, a plan, a roadmap, maybe even a path to prosperity or to the promised land. I've always referred to the budget as a moral document, a statement of values. It is clearly, as we can see, clear as daylight, whether the needs of the people are taken seriously by their elected representatives. I still believe that to be true today. However, in this day and age, I believe the budget has a new meaning. For women and men in this country who go to work every single day, who live paycheck to paycheck, for their families who have placed their trust in this administration, this budget is evidence. In a democracy, evidence is required to prove intent. You see, cold, hard facts cannot be explained away. Mr. Secretary, like you, I also served on the Budget Committee, and I know how to read a budget. I know this proposal is not the result of thoughtlessness or ignorance. The White House budget makes the question of intent crystal clear. You cannot speak these deep cuts and fake math under a rug or hide it in a dark corner. Over the last 7 years, there have been meaningful promises made to the American people. During the last election, Republicans vowed to not to harm Medicaid, Medicare, or Social Security. Let me say it again. You pledged not to harm Medicaid, Medicare, or Social Security. This budget is Exhibit A, ensuring that the promise has already been broken. Mr. Chairman, Americans are busy just trying to make ends meet. Most will not have time to watch this hearing or read it. This budget is wrong. How could they vote for one thing and get another? On that day, members of this committee will look back at this moment and point to the evidence of the crime this budget is a set of fingerprints. Your fingerprints. The fingerprints of this administration is on this budget. It is mean spirit. It's not good for America. We can do much better.
Thank you. Time has expired. Mr. Roscom, you're recognized.
Thank you, Mr. Chairman. Secretary Price, let's talk about the good things that are going on. Now, I'll say for the record that you used to sit right here, and by definition, everybody that sits to your right, further down, is happy for you, but they're really happy that you left because they can all move up. Myself and everybody this way, we're sincerely happy for you. So congratulations on this new assignment.
Thank you.
Now, Mr. Secretary, I know you've been active around the world of late. I know you've been traveling. I know you've been in West Africa. Can you give us a sense of what's going on in terms of global health and the leadership role of the United States in particular?
Well, thank you, Mr. Roscom. This is really an exciting story to tell because the United States has provided world leadership in the area of global health security. Through the WHO and other organizations, what we have done is rallied together tens of nations around the world to recognize that in order to provide health security for not just the United States but the world, that it requires nations working together and making certain that there's a minimum level of ability to provide surveillance, to provide detection of infectious disease and potential pandemics, and then to provide treatment, and especially treatment on site in country. I had the opportunity, as I mentioned, to visit Liberia a couple weeks ago, and I tell you, the exciting and inspiring people that I met the Americans who work for CDC, who work for the Department of Health and Human Services through CDC or through HRSA or through NIH, and are out there on the front lines. And those are the individuals that opened their arms to the folks who were suffering during the Ebola crisis. And the Liberian people and the Liberian government and the individuals that I met there were so incredibly appreciative of what you all did in providing the resources so that we can lead in the world of global health security. And you've seen the results of it, not just through the resolution of the Ebola crisis in Liberia, but through what Liberia itself was able to do recently when it had some meningococcus outbreak. And what they were able to do is detect it, to isolate it, to then treat it, all in country, all by themselves, along with the help of individuals from CDC. It's an incredibly inspiring story, and it's happening, yes, maybe below the surface, but it's to all of your good credit that we're able to do that as a nation, and the world understands the leadership that the United States provides.
Thank you. Mr. Doggett, you're recognized.
Thank you, Mr. Chairman, and thank you, Mr. Secretary, for being here. As you know, on January the 11th, President Trump told us, quote, "We have to create new bidding procedures for the drug industry because they're getting away with murder. We're the largest buyer of drugs in the world, and yet we don't bid properly. We're going to start bidding. We're going to save billions of dollars," end quote. Unfortunately, since then, we've had radio silence. In fact, we can't even get a tweet about the outrageous amount of price gouging that is occurring by pharmaceutical companies in this country. The budget that you present today is deficient not only in the harm that it does, which is great, but in the omissions that it contains. And this is particularly true with reference to pharmaceutical prices. Unlike President Obama, who presented a budget that had a provision specifically addressing the high cost of drugs and appeared to do the same thing that President Trump called for in January and last year by giving you, as Secretary, the authority to negotiate drug prices for Medicare, said that it would save $140 billion by doing that, and included a provision increasing transparency of prescription drug pricing that would lead to another $21 billion in savings. Your budget is silent on the issue of bidding or negotiating or doing anything meaningful to stop prescription price gouging. And I would just ask you to provide an answer in writing, since my time is short, as to whether the administration has rejected President Trump's bidding approach of January, as well as the approach that President Obama presented. He likes to reject just about everything that has Obama associated with it, or whether you have a plan to do something to implement what President Trump promised the American people last year he would do. Second, we learned only this week about the outrageous overcharging of the government through the HHS Office of Inspector General on EpiPens, $1.27 billion. I would ask you to answer in writing regarding how much of that money the government is getting back in the alleged settlement that began last year that Mylan announced in November or December, and I'll forward you documents on that. And finally, 50 of us asked in April President Trump to use the existing authority he has right now so that taxpayers are able to access the drugs that they paid for the research to get those drugs in accordance with reasonable standards, asking the National Institutes of Health to be involved in that. We've received no answer to our inquiry to President Trump, and I'll forward you a copy of that and ask you to provide a written answer concerning what the administration's position is. Seems to love to do executive orders and could do one on this and help consumers across the country. Thank you.
Thank you.
Thank you. As time has expired, Mr. Smith, you're recognized.
Thank you, Mr. Chairman. Certainly thank you, Mr. Secretary, for being here and sharing your expertise in terms of serving our country as a former practicing physician. We're grateful for your service. We know that the challenges are many, certainly as I represent rural and remote areas of the country in Nebraska. Critical access hospitals are very important. I continue to work on the 96-hour rule and trying to fix that. I think that stands in the way of efficient care in many of these facilities. Also, the physician supervision issue remains to be a problem, and I hear a lot from this or about this. Certainly also Nebraska hospitals, like their counterparts across the country and other states, continue to see reimbursement siphoned by the Bay State boondoggle. I know that you were a co-sponsor when you were on this committee to get rid of that. And so I've reintroduced a bill in this Congress and hoping that we can resolve that issue. But let me focus a little bit on human services, and certainly well within your portfolio at HHS. The home visiting program, referred to as McV, the Maternal, Infant, and Early Childhood Home Visiting Program, has been very successful. It's been very effective because it's evidence-based, and I'm anxious to continue to work on this. We introduced a bill already. As you know, it's a voluntary home visiting program that increases economic self-sufficiency and reduces abuse and neglect in at-risk families. And so the program, because it's evidence-based, I think has been successful. Are there other programs in the federal human services area right now which require taxpayer dollars be spent on an evidence-based basis? And would you be supportive of finding ways to make more of our federal poverty programs evidence-based? I think you touched a little bit on this in your opening testimony, but are there some quick things that you could point to that we can work on?
Yeah, this is incredibly important because, as I mentioned, we so often measure a success of a program by how much money goes into it in this town as opposed to whether or not it's actually accomplishing its goal. And so one of the things that we're trying to do at the department is there's so much intellectual knowledge and institutional knowledge within the department, but to charge folks to say, okay, if we were really measuring whether or not this program worked, what would we be measuring? Because it certainly wouldn't be how much money we put into it. It would be measuring whether or not people are aided, whether or not those moms are assisted in that early childhood care and the like. And so if we focus on those things that actually have metrics that determine whether or not the program's working, then we can figure out where we ought to be potentially putting more resources. But unless you focus on the outcomes, on the actual product that comes from the programs, you'll never get that, because then you're only left with how much money goes in. So the maternal and infant and early childhood home visiting programs are so incredibly important, and I'm really pleased to announce that in the budget we've increased the monies in that program, because it is evidence-based.
Thank you. Thank you, Mr. Chairman.
Thank you, Mr. Thompson. You're recognized.
Mr. Secretary, thank you very much for being here. You know, Dr. Price, I'm a bit mystified by the rhetoric on the so-called failures of the ACA. The Republicans and the administration officials have characterized individual insurance markets as being in a death spiral and that the law is imploding or collapsing. And these comments are at odds with the analysis from CBO, Joint Tax, Standard & Poor's, and other experts who've assessed this program. Projections from experts come in spite of a string of Republican efforts to undermine the law since its inception. The ACA was challenged in court the day it was signed into law. The court findings allowed states to reject Medicaid expansion and deny care to some of their residents. In 2013, Republicans snatched $3.5 billion from the co-op program. In 2014, Republicans gutted the risk corridor program. And this is the bipartisan stabilization tool that we use to stabilize Medicare Part D. Again, in 2014, the House Republicans filed suit challenging the administration's authority to distribute cost-sharing reductions. And I'd like to ask unanimous consent. I have a list of other sabotage efforts that were put together by our Senate colleagues. And I want to note that the President has carried on this legacy of sabotage and makes sport out of undermining the critical programs and deflecting blame for the consequences. You know, first, as you know, he issued the anti-ACA executive order. Then he cut outreach in the final week of the open enrollment. The IRS abandoned measures to tighten reporting for the individual mandate. There have been repeated threats to withhold CSR payments. And most important, the administration has supported repeal legislation that would turn the individual market on its head. Not to mention to eliminate pre-existing condition protections, levy an age tax, and impede some veterans' access to health care. And taken all together, these actions created a great uncertainty in the marketplace, and this is what's driven up premiums for our middle-class Americans. This administration will be wholly responsible for premium hikes we see coming this summer. And Mr. Chairman, again, I'd like to ask unanimous consent to read into the record this list titled Sabotage and Uncertainty Jeopardizing the ACA Markets. And this is comments from insurers and regulators that confirm that this has been a coordinated effort to sabotage. Yield back the balance of my time.
Thank you. Ms. Jenkins, you're recognized.
Thank you, Mr. Chairman, and thank you, Secretary Price. We are so thrilled to see you back with us today. In the fiscal year 2018 budget, it states that a goal of the department will be to reduce burdensome regulations. And I want to thank you for stating that explicitly, because there are two burdensome and unnecessary regulations that folks in Kansas need help with as soon as possible. I know you're familiar with them from your time on our committee. The first priority is to address a 2010 regulation issued by CMS in compliance with the Affordable Care Act that required outpatient therapeutic services to be directly supervised by physicians. While that may not sound so burdensome for many urban hospitals, the rule applied only to critical access hospitals which serve rural communities. And these hospitals can't afford to keep a doctor on staff at all times, and many can't afford to have a doctor on staff more than a couple of days a week. Kansas, as you know, has the most critical access hospitals of any state, and so suffers from the threat of this rule every year. In my district alone, there are 26 critical access hospitals struggling with this very regulation. Since 2014, I've introduced a temporary bill every year, worked with members of both parties to gain enough support to place them on the suspension calendar, worked with senators of both parties to get support for annual legislative fixes introduced there as well, and every year a temporary fix is passed into law. But then the process starts all over again come the next January. Can you pledge to work with me to permanently fix this problem?
Well, thank you, Ms. Jenkins, and you and I have spoken about this before. I know the challenge that exists in rural America, and especially in critical access hospitals, and our goal is to make certain that the patients are able to receive the kind of care that they need in those hospitals in a timely fashion with appropriate personnel, and your issue is very, very pertinent, and we are in the process of looking at it as we speak.
Thank you. We'll look forward to working with you on that. The second issue relates to the many hospital-based nursing programs that provide accredited training for nurses. Several years ago, and without warning, CMS changed the standards for those programs to receive funding on a pass-through basis, and the new standard presents a catch-22 that does not allow them to remain accredited if they want to receive the funding from CMS. In my congressional district alone, this leaves Stormont-Vail Hospital and Baker School of Nursing in a difficult position. Again, will you just work with us to address that issue as well?
Absolutely.
Thank you, Mr. Secretary. I really appreciate your understanding of these priorities and the limited time given to discuss them with you today. I really look forward to working with you on these and other issues. And Mr. Chairman, with that, I would yield back.
Thank you. Mr. Larson, you're recognized.
Thank you, Mr. Chairman. Mr. Chairman, I want to associate myself with the remarks of Mr. Thompson and specifically the information that he submitted for the record. I think it's long overdue that the committee focus on what is imperiling Americans as we speak. The CBO report confirms that 23 million of your fellow Americans, families, children, they're going to be without insurance. And the bill that passed the House was ramrodded through. Now appears that it was over in the Senate, and they put together a committee of 13, I guess, and Patty Murray and Bill Cassidy have a bill of their own that they're working on, and 23 million Americans are going to be without any coverage. And there's nobody that seems to pretty much care about them because it's too important to make political points. at a time when they go to sleep every night wondering whether or not they're going to have care that they need. People with pre-existing conditions, you talk about death spirals. It's our fellow citizens that look to their government to make a decision and to help them through this process. It is agonizing to sit in a committee, to know where you have very little input, and to see a bill travel over to the House that, again, for political theater, is going to go through a great kabuki dance and ultimately end up maybe, maybe not, though Mitch McConnell has said today that they're going to use some kind of martial law, whatever change in the rules they need in the Senate to bring to the Senate, again without hearing, a bill that they will pass or not pass. 23 million Americans will continue to suffer while Congress fiddles and diddles. It's long overdue that we sat down and worked together. Yes, I think this side has admitted several times there were many flaws within the Affordable Care Act, but nothing that couldn't be fixed or repaired along the lines of what the state of Massachusetts had, where they put together a health care program by a Republican governor named Romney, and were able to work out the details of a philosophical plan instituted by the Heritage Foundation. It's long overdue that we work together on behalf of the 23 million Americans who will lose their insurance.
Thank you, Mr. Paulson. You're recognized.
Thank you, Mr. Chairman, and Dr. Price, I want to welcome you back to committee today. Dr. Price, as you know, my home state of Minnesota has a long history of being on the cutting edge of a lot of medical innovation. That's certainly true today. During the last year, I've had the opportunity to visit with several companies in Minnesota who are at the forefront of integrating technological advancements into healthcare delivery. One of those companies is Hypnosis, that uses software as a service. They've become a disruptor in the telemedicine space by creating an online adaptive interview platform that improves patient outcomes and then drives down costs. Another company I went to, Novo Health, is using data-driven health incentives to help keep patients engaged in living a healthy lifestyle that reduces the long-term health complications. And I've also visited with another new startup called Gravy Incorporated, which is building tailored benefits packages that employers and employees actually want to use. So these are three different companies doing very different things in the healthcare space, but what they have in common are two things. First, they're all harnessing that power of technology and innovation to build a better healthcare delivery model that has the potential to provide better outcomes for patients and at the same time drive down costs. And then secondly, during my visits with each of them, they all highlighted current regulatory barriers that have stood in the way of their progress. So Dr. Price, what are some of the things that you think HHS will now be working on specifically in the innovation space to create that regulatory environment that protects patients and taxpayer resources, but also allows innovative companies like Hypnosis and Novo Health and Gravy to thrive? This is an incredibly important issue because when I have talked to my former medical colleagues about the cutting-edge kinds of things that are out there, many of them will actually say that they no longer look to the United States companies to see what's actually pushing the envelope. They're looking to companies overseas because of the kind of regulatory barriers that are in place or have been put in place, most often by the federal government. So I'm so thrilled that Scott Gottlieb has been confirmed at FDA, because FDA is the entity that looks at so many of these devices and innovations and provides for a streamlined fashion for them to come to market. And I've charged him, the President's charged him with absolutely committed to having an accelerated pace to get safe devices, safe innovations to market so that patients are able to benefit. But there are regulatory hurdles. There are hurdles in terms of reporting requirements. There are hurdles in terms of just the timeline that it takes to be able to put in place a proposal and gain the feedback that's necessary from the federal government. We're going to do all that we can to make certain that the United States once again becomes the leader in the world when it comes to medical innovation. Thank you, Dr. Price.
Thank you. Mr. Blumenauer, you're recognized.
Thank you, Mr. Chairman. Welcome back, Tom. After having shared the dais with you for these many years, I look forward to a more robust give and take. I'm sorry there was only time in your schedule to allow 3 minutes per member. So I will just say something, because I'm hopeful that there's an opportunity for some introspection because of your different role today. You're an appointee of a president who's vowed to destroy the ACA and who has espoused a world health care view diametrically opposed to the independent experts and indeed most of the people in the healthcare community who appear before this committee. From the beginning of this administration, the effort has been to increase the instability and make the ACA fail. Of course, since the Republicans controlled this committee, there was never an effort to refine or fix relatively minor items that would have made its operation smoother. You could have given certainty to insurers, expanding the reinsurance program, not removing it. You could have expanded the cost-sharing subsidies or tax credits to help low-income individuals who were too poor to get the subsidy. Or you could have tackled the issue of high-cost prescription drugs where the president has opened the window that would continue to drive up health care costs. All of these things could have been bipartisan measures that we could have talked about today. When the president assumed office, his first action was to accelerate the uncertainty facing the healthcare industry with an executive order directing federal agencies to undermine the regulations, indeed the mandate, which, as we all know, was a Republican idea that was incorporated into the ACA. You directed the Internal Revenue Service to stop enforcing the requirement to have insurance. They could have stopped sending refunds to taxpayers if they failed to provide proof of insurance. You signaled no. The department cut advertising by 75% for television, canceled all digital advertising for ACA enrollment, leading, in some estimates, to 500,000 fewer Americans getting coverage, which added to the instability. There are further uncertainties about whether the president and your department are going to continue to make key payments that are necessary to make sure the law functions as planned, providing subsidies on which millions of Americans depend. And this fuels uncertainty with insurance companies, and you can read their quotations in the papers this week. I would hope that in your new rule, with the responsibility for the overwhelming majority of people who want the system to continue and want it improved, that you could reflect on the possibility that you could actually enforce the law, you could promote it, you could work to not actively undermine it. I would hope that the administration wouldn't be gleeful, would be sobered by millions of Americans who benefited and relied on this program. I would hope that you would listen to the independent voices, the doctors, the nurses, the hospitals, the insurance industry, who rely on the Affordable Care Act and try and make it work. You, after all, as a physician, and you paraphrase the Hippocratic Oath repeatedly when you were a member of this committee, to first do no harm. And you're in a position to not do further harm as we work together until and unless we get the nirvana that the president has talked about, better health insurance, lower cost, and more people covered. Well, there's nothing in the horizon that's going to do that, and unless and until we get it, we'd hope that you would work with us to make the ACA work. Thank you for your courtesy.
Thank you.
Thank you, Mr. Martin. You're recognized.
Thank you, Mr. Chairman. Good to see you, Mr. Secretary.
See you, sir.
In September in Texas, we had September the 1st, 2016, the CMS issued a notice to our Health and Human Services Commission that they were disallowing $26.8 million of federal payments under the 1115 Medicaid waiver uncompensated pool payments. Now, there's much belief in Texas that the reason why, and this affects mainly two main hospitals that I represent in Tarrant and Dallas County. Now, there's some belief that this was an indirect punishment for Texas not expanding its Medicaid base under Obamacare. Can you tell me what the status of those reimbursements are? Can you tell me what the policy is going to be going forward? And is there any hope that Texas will be able to change that interpretation?
Yeah, Mr. Martin, as you know, I think you know that there are ongoing discussions and conversations between the state of Texas and CMS about that waiver. And I had a conversation with the CMS administrator as recently as yesterday about this, so I'm hopeful that we'll be able to reach a conclusion.
Okay, thank you very much. Another thing is that Mr. Blumenauer and I are working together on some legislation that pertains to the Home Health Documentation Program Improvement. It's called the Home Health Documentation and Program Improvement Act. And it basically allows for the doctor's records to go with the patient when the evaluation's done to consider whether home health is appropriate or not. And we'd just like to, I'd like to get your comments on that particular approach to home health services.
Well, I think in this area and in all areas, the more opportunity that we provide for patients to have access and control of their records so that there is a seamless transition from caregiver to caregiver, and it's the patient that is selecting that caregiver, then the more efficient it is for the patient. But the decrease, we would decrease redundancies, duplications, tests, studies, costs in the system. And so there's a lot of merit, I believe, to having the patient have control of those records.
Thank you, Mr. Secretary. Yield back.
Thank you. Mr. Kine, you're recognized.
Thank you, Mr. Chairman. Mr. Secretary, it's great to have you back to the committee.
Thanks, sir.
The HHS budget calls for eliminating almost all of Wisconsin's federal rural health funding, including nearly a 50% funding cut to the rural health program, zeroing out funding for the Medicare Rural Hospital Flexibility Program, the FLEX program, Small Rural Hospital Improvement Grant Program, the SHIP program, the State Office of Rural Health Grants. Together, these programs bring over $1.5 million into Wisconsin every year for rural health care activities and support. The SHIP program alone sends over $500,000 every year to rural hospitals throughout the state for quality improvement projects. The FLEX program provides funding for quality improvement projects done in collaboration with the Wisconsin Hospital Association, the Rural Wisconsin Health Cooperative, the American Heart Association, and many others. It also provides funding for in-depth financial analysis for rural hospitals, creating revenue cycle recommendations and follow-up support. Finally, the State Office program creates the Wisconsin Office of Rural Health, allowing for the hosting and implementation of these grant programs, as well as provide physician recruiting, rural health newsfeed, a host of data, maps, other resources for rural health care and communities. And according to a recent study done by the National Rural Health Association, nearly 1 in 3 rural hospitals are at risk of closure due to proposed Medicare cuts and over $800 billion reduction in funding to Medicaid, our Badger Care program. I can certainly see Mick Mulvaney's fingerprints at OMB all over this. I have a hard time believing that your agency at HHS would embrace this declaration of war against a rural district such as mine and throughout our country. I look forward to working with you at HHS to make sure that rural health has a place at the table. I think there's great bipartisan support, making sure that we've got a voice, we've got a seat, and that these issues are concerned because you know, and given the district you formerly represented, unless you have a strong, stable rural health care provider, it's impossible to retain and recruit the businesses and the good-paying jobs in those communities. These are often the anchors of community support and the vibrancy of any rural community. And so rural health needs to be, I think, addressed in a specific way given the unique and specific challenges that are placed in that area. I'm especially troubled with what is moving through this Congress right now under the guise of health care reform, a $900 billion tax cut for the most wealthy and to insurance companies and to drug companies under the disguise of health care reform, cutting drastically Medicaid funding, increasing price discrimination against older Americans in rural areas such as mine, potentially allowing insurance companies to once again discriminate against individuals with pre-existing conditions. There are opportunities for us to work together to improve what isn't working in the healthcare system. I would hope that we have an opportunity to retrench and take another run at the healthcare system. We can do so on a more collaborative and bipartisan basis than what's been worked on over the last few months. Thanks for coming. Mr. Chairman, I yield back.
Thank you. Mr. Kelly, you're recognized.
Thank you, Chairman. Dr. Price, always good to see you.
Great to see you,
if
sir.
you could, and I don't want to get too deep into this, but just to clarify things, could you address this fact or this idea that somehow 23 million people are going to lose their insurance? The big factor in there is people are going to be able to choose not that they're going to lose, but they're going to be able to choose, right? I mean, so these numbers that we keep throwing out there, kind of very scary to hear that, to think that somebody would be so cruel as to keep 24 million people from getting insurance, or 23 million. The number just seems to go up and down depending on who you're talking to and what time of the day it is. Isn't the reality of it, they're going to make a choice, and they may choose, because they don't have the individual mandate, just not to do it.
Yeah, a couple points, and I appreciate the opportunity. It's first important to understand and appreciate that there are 20 million Americans right now who don't have health coverage. 20 million Americans right now don't have health coverage under the plan that was supposed to make certain that everybody had health coverage. Now, they don't have health coverage because either they said no thanks, and we so disagree with what we're supposed to buy or mandated by the government to buy that we're willing to pay a penalty, pay a fine for that, or they've gotten a waiver. But what that ought to tell us is that we're not selling what they want to buy. And so the individuals that the CBO cites are individuals that may not be covered under the current rubric, under the current plan, but that doesn't mean that they won't be covered, because our goal is to make certain that every single American has health coverage. But it's health coverage that they want to purchase for themselves and for their family, not that the government forces them to buy. So look, CBO, they've got a tough job, because what they're looking at is something in isolation. They're not looking at the entire plan and proposal that has been put forward. If you look at the entire plan, then again, our goal is to make certain that every single American, we want it to gain 100% coverage for individuals. But the only way that you do that is you make it so that individuals are able to select the coverage that they want.
Yeah, and I can appreciate, you and I have talked many years about this, and because of where you're from and what you do, and what your life was all about, not only you, but also your wife. One of the other things, just want to talk real briefly, because we do have legislation that would address this. It's the benchmark cap and Medicare Advantage that's part of the Obamacare program, and it's cost a lot of seniors, in my district and districts all over the country. This problem goes against a widely shared goal of paying for quality. Now, Mr. Kind and I have some legislation that addresses that, but I remember you and I would talk about these things, and it got to the point was, how much will it take to fix this problem? And it always comes down to just a little more money. Not a little more money well spent, but just a little more money. And I think that from time to time, we think that throwing dollars at the problem is the answer. But there are ways of addressing these inequities. You've always had such a positive approach to it. So I'm looking forward to actually working with somebody who understands that these are business models at the end of the day that have to be sustainable, not aspirational. But people can believe that when they have health care coverage, they're going to have health care coverage. I just think we've done a disservice to the citizens of the United States, making them think that somehow they're losing something because of hard-hearted or evil-minded people that are trying to do something that's truly sustainable and not a promise we can't keep. Thank you, Doctor. Looking forward to working with you.
Thank you. Mr. Pascrell, you're recognized.
This is a terrible business model. I'll take your turn. Dr. Price, welcome.
Thank you, sir.
Many Americans would agree that this administration has a lot of explaining to do when it comes to this budget. As the co-chair and the co-founder of the Congressional Brain Injury Task Force, and I take this issue because it's not billions of dollars we're talking about here, but it really reflects the nonsense throughout this budget. For the past 17 years, the Federal Traumatic Brain Injury State Grant Program supported state efforts to address the needs of persons with brain injury. It has helped expand and improve services to underserved and served populations, including young people, veterans, and returning troops, and individuals with co-occurring conditions. It was a $9 million program, a drop in the bucket, we would all agree. With $9 million, this program was able to support only 18 of the states of the union, meaning that with that level of funding, we aren't coming close to reaching everyone in need. The Trump budget cut this program by 2/3. If that isn't malfeasance in office, I don't know what is. We're only sticking with small stuff, though. I'll get to the big stuff if I have time. Beyond problems associated, combining three very different programs into one. This is their solution to the program. The last speaker talked about there's other ways. You just don't throw money at the program. We all know that. We're not stupid. We're not infantiles. We know you don't just throw money at the problem to solve it. But this was a tried and accomplished program that worked. It worked with our troops. How do you think states can meet the needs of every one of the programs that have been cut. Let the states handle it. Where are they going to get the money? We'll use our initiative. Now, on page 7 of the CBO report, it says this. We're talking about waivers you talked about before. 1/6 of the population live in states that will seek waivers for both the community rating and essential health benefits protections of the ACA. In these states, quote, less healthy individuals would face extremely high premiums. Too bad. And over time, quote, would be unable to purchase comprehensive coverage with premiums close to those under current law and might not be able to purchase coverage at all. So let's look to maternity. I mean, you can't believe this. Everything's wonderful. Everything's coming up roses. Insurers would expect most, oh, this is right from the CBO.
All time being expired.
Yeah, you better believe it's the time is
We'll
expired.
go to 2-to-1 questioning. Mr. Renacci, you're recognized.
Thank you, Mr. Chairman, and thank you, Dr. Price. I remember calling you friend on the phone before I was elected, then colleague, then chairman, and now secretary, so I applaud you being here.
Thank you.
And I appreciate your perspective when it comes to the budget. You were the budget chairman as well. You know, the greatest threat to our country is our national debt. You knew that when you're on the budget committee, so I applaud the budget that you've tried to put out there. It's not perfect, but it's a good starting point. But we talk about the greatest threat, and I've heard this from my colleagues. The greatest threat to our country is our national debt. Today, justfacts.com reports that our national debt today is $61,000 per every citizen in the United States, $157,000 per every family. That's the threat that we have to worry about. And we also had the Comptroller General come before the Budget Committee and say that our spending is unsustainable, and Medicaid expansion is part of that, is unsustainable. So I applaud what we're trying to do. Also, I heard one of my colleagues talk about pre-existing conditions, and I want to just throw this out. There was a fact check, Washington Post, 4 Pinocchios, that says pre-existing conditions could deny people coverage under the GOP health care. So that comment came out. I just want to respond to that. I want to flip back, though, to the opioid crisis, which I do think is a serious issue. You know, Cleveland Clinic CEO Toby Cosgrove put the crisis in perspective when he said to me, during the Vietnam War, 53,000 people died. And just last year, 53,000 people died from the opioid overdoses, essentially the same amount of losses we had in Vietnam. The only difference is that we don't see the body bags coming home. So it is an issue, and it is a problem. And I think, back home in Ohio, of course, is the #1 state in the country for opioid overdose and abuse, which I'm not proud of, and it's one of the things we have to change in Ohio. It's not about attorneys, it's not about policies, it's not about lawsuits, it's about people. So I've met with countless constituents in the state of Ohio, and I've met with addicts to find out what their concerns are, why this is happening. And it's they tell me, look, a feeling of hopelessness, a feeling of not being able to, feel like they're worth anything. And we got to look to that. It's not a lawsuit, it's about them. And I want to get back to your testimony. You state that the current law prevents states from prioritizing federal resources to the most vulnerable populations, and that states are also limited in testing new ideas that will improve access to care and health outcomes. Knowing that tackling this crisis is a priority to you and President Trump, can you discuss maybe some of the current federal regulations that may hinder the state's ability to address the current opioid epidemic?
Yeah, I think that I've traveled around the country as well, and to the state of Ohio also to try to address this crisis. And one of the first impressions that I've gotten from visiting with addicts, with former addicts, with law enforcement, with local officials, with moms and dads and family members who've had folks who have died from overdoses, is that feeling of hopelessness, yes, but also that the solutions are local solutions. That when communities come together and are able to rally around and lift folks up and help individuals regain that hopefulness, that's one of the keys. And that's what we're trying to do, is to identify those evidence-based areas that are actually solving this problem so that we can turn the corner.
Thank you.
Thank you. Ms. Nomi, you're recognized.
Thank you, Mr. Chairman, and thank you, Mr. Secretary, for being with us today.
Thank you.
I appreciate your willingness to take on a leadership role in a department that's impacting every single American's lives today, and we really need your help. I want to ask you specifically for help with Indian Health Services, because they are failing our Native American tribes. And in South Dakota, we have third world country delivery of health care. And even though we have a new administration, we haven't seen changes out of that department, and we need to fix it, and it starts with leadership within the agency, and I'd love to have a longer conversation with you about that. In fact, I'm going to submit some questions for the record. If you would answer those for me, that would be great. Because I wanted to talk to you about health care today in a broader perspective, and because I want to associate myself with the comments of Representative Jenkins and Representative Smith on the struggle that we have in rural America in delivering health care and making sure that services are there. And we've heard the other side of the aisle talk today about the fact that Republicans are to blame for increased health care costs this summer, that Republicans are to blame for individuals who are not covered under health care. And we know when you talk about coverage, that doesn't necessarily mean access. I talk to South Dakotans every single day that under Obamacare maybe have a policy, but they can't use it because their deductibles are so high. They have no access to those health care opportunities in front of them. So I would like you to discuss, first of all, and clarify the record of what we've heard here today. We're operating under current law and the challenges that we face delivering health care to individuals out there and who are struggling. And if the legislation that we passed through this committee was put into place and we repealed the mandates, repealed the taxes, gave some new opportunities for the marketplace, how that would change our perspective and our opportunities in the future. I would just love to hear you, because you have the experience. Now you're on a different role today. You're sitting in a different chair. Tell me about the changes that we could see if we did health care reform and signed it into law.
Well, I think it's important, and I thank you for that, because I think it's important to think about what the mission is. What are the goals? And the goals are, again, to make certain that every single American has access to the kind of coverage that they want for themselves and for their families. So through the series of subsidies, tax credits, whatever you want to call them, we want to make certain that each American has the financial feasibility to be able to, one, purchase that coverage, two, to be able to purchase coverage that they want, not that the government forces them to buy. So that what the federal government says is right for one person may not be right for another person. And it's so important because health care is absolutely unique to each and every individual. So the kind of concerns that individuals have, and the fear that they have about getting sick and not being able to afford coverage, we need to take that away. The opportunity that we have to provide that kind of reassurance to the American people through a system that allows for that coverage is so incredibly important, and that's our goal.
One of the Democrat members of the committee stated here today that the high cost increases that we're going to see this summer are to blame because of Republicans. Would you blame that on Republicans or current law?
Well, the current law, as we demonstrated through the department, has shown doubling of premiums and significant increases in the deductibles, which make it, as you said, many people have coverage but no care.
Time has expired. Mr. Crowley, you're recognized.
Thank you, Mr. Chairman. We have very little bit of time. Mrs. Secretary, thank you for being here.
Thank you, John.
Welcome back to the committee. Mr. Secretary, did you stand by the President's budget that he submitted to Congress for 2018?
The portion that I have available to me to have input into is the HHS budget, and I stand by that budget. I
suppose that's a form of honest loyalty. I appreciate your response. But Mr. Secretary, as you've heard so far, there's a lot of elements in the HHS budget that are very concerning to us and to our constituents, such as the deep cuts in Medicaid and Social Security and so many other programs. These cuts reflect a troubling lack of concern for the real and significant difference that these federal programs make in the lives of working Americans. For example, when the budget proposed cutting heating assistance, the administration said it was to, quote, reduce the size and scope of the federal government, end quote. Well, I'm sure that explanation will be comforting to the families in my district who struggle with high heating bills and very cold winters. A budget is a statement of priorities, and the priorities in this budget are simply wrong. Cuts for the sake of cuts are wrong. And one area in particular that highlights this is the social services block grants. That's the programs that service vulnerable populations like frail seniors, at-risk youth, and working families. It funds Meals on Wheels programs. In some cases, it's the sole support for those programs. It funds adult protective services so that seniors can continue to live in their homes free from the fear of abuse, neglect, and exploitation, and not have to move into a nursing home and burden their working children. It funds child abuse interventions, keeping children safe. That's the program you're eliminating and the part of the budget that you support. I suspect that your former constituents back in Georgia 6 would be very disappointed in understanding that that portion, which comes to the HHS, the portion you're supporting of the budget the President has proposed, that's in this budget. What really gets me is that this program for years has had bipartisan support. It was applauded as a model of, quote, flexibility for states. Even former Ways and Means Chairman Dave Camp was one of the champions of SSBG, saying that, quote, SSBG has been a key source of flexible funding for critical social services. And now it's being eliminated because it's somehow too flexible? That is particularly concerning when you're also talking about block granting programs like Medicaid, because it's not just SSBG. We have a chart, and I'd like to put it up on the screen. Let's make reference to it. Heating assistance that helps over 6 million families a year, eliminated. The Community Development Block Grant helped at least 12 million people a year, has been eliminated under the budget that you support. SSBG funded services to 30 million people, including about 2 million seniors, is eliminated. The Community Service Block Grant served 15.6 million individuals, 37% of whom were in children and 21% seniors. They're eliminated under the portion of the budget that you support. I dare say that if that budget were put before the Congress tomorrow, more than half of your colleagues on the other side of the aisle would vote against it. I yield back the balance of my time.
Thank you, Mr. Holding. You're recognized.
Thank you, Mr. Chairman. Secretary Price, what a privilege to have you back here, albeit on the other side of the table there. I want to personally thank you for your response to my letter that I received recently with respect to FDA's deeming regulation. I'm looking forward to continue to work with you and your very able staff on that issue. Shifting gears, I see in your department's report on the individual market premium changes that in North Carolina, the average annual premium cost increased from $2,800 in 2013 to almost $8,000 in 2017. So obviously in just 4 years, premiums in my state have almost tripled. And currently, 95 of North Carolina's 100 counties have only a single insurer in the ACA marketplace. So my question to you, Secretary Price, is what actions in your department are you taking to provide certainty to North Carolinians and ensures that North Carolina will have a viable insurance marketplace in the future?
Well, thank you, Mr. Holding. The truth of the matter is that there needs to be a change in the law. The current law is what has resulted in what we see right now with doubling of the premiums, with individuals having deductibles that are unaffordable. You have 3 states where the premiums have tripled. You've got insurers vacating the market almost by the day. The challenges that most of them note have occurred from 2013 to 2017. So what we're trying to do is to make certain that the opportunities that individuals have out there are ones that will allow them to get the kind of coverage that they want. Earlier this spring, we put forward a market stabilization rule to try to make certain that insurers and states had greater opportunity to keep insurers in the market through the special enrollment periods and the grace periods for the purchase of coverage, to allow the states to be the ones that are defining what a qualified health plan is. We sent letters to every single governor of the state about 1332 waivers to make certain that they knew they had other options in the area of the individual and small group market, and 1115 waivers that let them know that they had more opportunities in the area of Medicaid coverage. So what we're trying to do is to work under the current construct, but the fact of the matter is that the current construct's broken. And it needs to be fixed, and the only way to fix that robustly is through a change of the legislation.
Thank you, Mr. Secretary. Mr. Chairman, I yield back.
Thank you, Mr. Crowley.
Mr. Chairman, I would ask unanimous consent to include in the record the chart that was previously displayed during my series of questioning of the Secretary.
Yes, without objection.
Thank you.
Dr. Davis, you're recognized.
Thank you, Mr. Chairman. Thank you, Mr. Secretary. Welcome back. As you know, 184 members of Congress from both sides of the aisle sent you a letter last week. I signed the letters, did 9 of my colleagues here on the Ways and Means Committee. The letter expresses concern over a 2014 rule issued by the Centers for Medicare and Medicaid Services on the topic of charitable premium assistance for plans in the Affordable Medicare Act. The interim guidance is highly ambiguous and unclear, and some insurers have interpreted it as being a license to refuse
all charitable premium payments for all insurance products, including Medigap, for certain high-cost patients, such as people with end-stage renal disease. In the letter, we urge you to issue a new rule that adds the following to the existing list of entities from which premium and cost-sharing assistance is required to be accepted: bona fide nonprofit charitable organizations, places of worship, local civic organizations, who are equally important. Of course, those charitable premium assistance programs must ensure that patients are empowered to select the plan that works best for their needs based on the patient's own health and financial considerations. Could you answer that in writing for us?
Yes, sir.
And then, Mr. Chairman, I've been glad to see President Trump's acknowledge what a challenge child care is for working parents, but I see that your budget cuts support for child care by over $400 million a year. When you take into account all the different cuts to programs states use to support child care, even without those cuts, you're projecting that within 5 years, the number of children served will reach a record low. We can do better for working parents and for children, and I hope that President Trump will stand behind what he's said about child care, including reconsidering those cuts.
Thank you. Ms. Black, you're recognized.
Thank you, Mr. Chairman. And again, welcome, Mr. Secretary. It's so good to have you back here with us. I want to talk about the IPAB, the Independent Payment Advisory Board. It's projected to kick in as soon as this year, and I know that members of the committee and also the American public are really deeply concerned about the idea of a board of bureaucrats who will have that sole purpose to cut the payments to healthcare providers for our senior citizens. So to be clear, their job is cutting seniors' access to health care if it were to go into effect. In the absence of there being someone appointed to this IPAB at this particular point in time by either President Obama or President Trump, who would make those decisions in the IPAB without those bureaucrats already being assigned?
Under the current law, that responsibility falls to the Secretary.
And so that would be you,
That would be me.
obviously, to make those decisions. Are there some thoughts about what you would have us do? Would you like us to get to work to repeal this, or what's your opinion on that?
Well, the budget reflects an ending of the IPAB program.
So that would be a good thing for our seniors, and I hope they're listening to know that we are well aware that this will hurt our seniors if it does go into effect. The second thing that I would like to ask you really quickly is the area wage index that we have talked about before, but I want to especially talk about those rural hospitals in Tennessee and all throughout the United States, really, that are unfairly being reimbursed at lower rates with a flawed formula. And when the formula was originally put into place, it reflected that an average rate of 1 would be what would be given. But there's not a single hospital in the states of Tennessee, Alabama, Georgia, Ohio, Texas, South Carolina, Louisiana, Kentucky, Arkansas, Iowa, Kansas, Missouri, or Utah that are either at or above that, quote, average level, which is very concerning and really hurting us, especially in those rural hospitals. So I'm looking forward to working with you and others in your staff to try to find a way to make this more equitable so that those hospitals that are doing a good job and they're really trying to keep the costs down, and in actuality, they are being punished because they're doing such a good job. And so rural hospitals, as you well know, are just so important in our districts. In my district, I have a lot of them. And the thought that they're going to be closing down and leave people in those areas without any care is very concerning. So I hope that we can address this as soon as possible.
Look forward to that.
Thank you.
Thank
I
you.
yield back.
Thank you, Mr. Higgins. You're recognized.
Thank you, Mr. Chairman, and welcome, Mr. Secretary. I just want to talk about the Medicare Advantage program. 17 million, or a third of the Medicare population, is enrolled in Medicare Advantage programs. United Healthcare is a major player in this market with 20% of the Medicare Advantage population, or over 3.5 million people. Are you familiar with the American Health Care Act, page 67, where private insurance companies can claim executive compensation as a business deduction from their federal taxes?
Not specifically, no.
Okay. Well, it's there. The chief executive officer of United Healthcare was compensated $66 million in 2014. This provision of the bill that passed this committee and the House will give United Healthcare executives a $15.5 million tax cut. Are you familiar with the fact that 3 weeks ago, the United States Department of Justice joined a lawsuit against United Healthcare for defrauding the Medicare Advantage program out of billions of dollars each year over the past 7 years?
What I can say is that we have increased the amount of resources available for program integrity to try to keep those kinds of things from happening if, in fact, that did occur.
Mr. Secretary, this is serious allegations of fraud out of a program that's administered out of your department.
That's precisely why we've increased resources so that program integrity can increase.
Well, what happened? Well, does this concern you that we're providing, within the context of health care reform, a massive tax cut for a company that is under investigation for defrauding the American taxpayers out of potentially hundreds of millions of dollars and likely billions of dollars each year?
As I said, the department is absolutely committed to program integrity, and we've provided increasing resources because it's one of the areas actually that allows for a significant return on that investment, if you will.
Well, claiming back my time, don't you think that while this investigation is being carried out by the United States Department of Justice, that provision of the health care bill should be excluded in this bill? The overall bill should be voted on again, giving members who have a sense of decency and fairness to vote on a bill that excludes a provision to give a massive tax cut to a company that is alleged to have defrauded the American people in the Medicare Advantage program out of hundreds of millions of dollars a year.
I'll leave to the House the opportunity to take care of the legislation that they deal with.
Time has expired. Thank you, Mr. Rice. You're recognized.
Thank you, Mr. Chairman. Thank you, Secretary Price, for appearing in front of us. I applaud your intelligence and your dedication to the people of the United States. I know you've been to my district, and you've seen the medical care providers, and you've seen the people, and you recognize the needs in our district, in my district, in South Carolina, where I'm from, Georgia, where you're from, really not that dissimilar. I have a lot of rural communities, rural hospitals, and we'll never get the cost of health insurance in line if we can't rein in the cost of health care. And one of the ways to do that is through telemedicine. These rural areas are connected to more sophisticated medical providers through telemedicine. And in fact, in 2016, the South Carolina Telehealth Alliance conducted 135,000 patient interactions across almost 300 sites across the state. The Alliance uses telehealth in emergency rooms, patients' homes, clinician offices, correctional facilities, nursing homes, and schools to treat everything from a sore throat to a stroke. In 2010, nearly 40% of stroke victims in my district had to be transferred to Charleston for treatment. Through the use of tele-stroke services, that percentage has dropped to 15. So what I want to know is, where are you on telemedicine, and what can we do to partner with the administration to make sure that this procedure is used responsibly to both provide better care at a better cost?
Yeah, this gets to the dynamism of healthcare and the kinds of things that can occur to help patients in so many, many ways, especially in rural areas. So many questions about rural healthcare and making certain that we have the highest quality care in rural areas of our country is an absolute priority. And telemedicine is one of the keys to that. We've seen over the past decade or so an explosion in the ability of technology to be able to literally transport the problem, not the patient, but the problem, to a setting where there are experts that can be able to assist those individuals on the ground in the smaller communities. So it's an absolute priority. Government is usually relatively poor at changing as rapidly as technology or the innovation that's out there. One of the priorities that we have is to make it so that the healthcare system can be as dynamic as the innovation that's being created.
Thank you, Mr. Secretary. I yield back my time.
Thank you, Ms. Sewell. You're recognized.
Thank you, Mr. Chairman. And welcome back, Secretary Price.
Nice to see you.
Thank you for coming today to provide our committee with insight about this administration's budget priorities. The American people deserve clarity. Because the President told us he would not cut Medicare, Medicaid, or Social Security, we need only look at his tweets when he was a candidate. On May 17, 2015, candidate Donald Trump tweeted, "I was the first and only potential GOP candidate to state that there will be no cuts, I repeat, no cuts to Social Security, Medicare, and Medicaid. Huckabee copied me." On July 11, 2015, candidate Donald Trump said, quote, "The Republicans who want to cut Social Security and Medicare are wrong. A robust economy will make America great again." On October 30th, 2015, he tweeted, quote, "I am going to save Medicare and Medicaid. Carson wants to abolish it." And failing candidate Governor John Kasich doesn't have a clue, weak. So, Mr. Secretary, despite these promises, the Trump budget slashes Medicaid benefits by up to $64 billion over 10 years. Medicaid is cut by $1.4 trillion. And by extending the sequester, the Trump budget includes a $33.5 billion Medicare cut. So, Dr. Price, if Congress implements the recommendations of the budget, the FY18 budget, I'm assuming that President Trump would sign that bill. So in effect, the President is breaking a very important promise. The people that I represent back home in Alabama are looking for the truth. And it breaks my heart to know that millions of Medicare and Medicaid recipients across this country have put their trust in a man that would break their promises. Mr. Secretary, this is really about real health for real people. What is most offensive is that the Trump budget uses the cuts to funds. They use the cuts to these funds to actually provide a tax cut for the wealthiest Americans. Both in rhetoric and in our policies, we have been demonizing the programs that most people rely on. I think it is very clear, and my hope is that this administration will not pass a budget that cuts Medicare, Medicaid, and Social Security. I want to associate my comments with Ms. Black because she and I both are working on rural health and health care, and we want to make sure that the wage index is fair across the board. So I want to work with you and her on that issue. But make no mistake about it, I think the American people are watching, and we have to keep our promises. We shouldn't be cutting Social Security, Medicare, and Medicaid. And I can tell you that my constituents will indeed be watching. Thank you, sir.
Thank you. Ms. Walorski, you're recognized.
Thank you, Mr. Chairman. Mr. Secretary, thanks so much for being here. I had sent you a letter on this. I just wanted to mention it briefly today, but I just wanted to thank you for your incredible leadership as you were talking about being in Africa, your global leadership, your concern about global health. I just wanted to bounce a question off you and share with you my concern with the guidance the WHO Secretariat developed and rushed through last year. It calls for significant new restrictions and even prohibitions on the promotion and marketing of milk products for children up to the age of 3. They provided no scientific evidence. They conducted no analysis of its potential impact. But now the WHO is incorrectly presenting their guidance as a new international standard, and it's pressuring governments to implement it. I'm concerned about the impact the WHO's guidance could have on children throughout the globe. I'm concerned for no good reason bureaucrats at the WHO are leaving parents and caregivers without a critical tool that aids in a child's growth and development and preventing doctors from sharing information on the full range of options available for a child's healthy development. I sent you a letter with 15 of my colleagues kind of addressing this, knowing that you're taking a lead in global health. I just wanted to get your thoughts on this. Did this issue come up a few weeks ago when you were at the World Health Assembly? And then, and what can we do as Congress to maybe be helpful in your efforts on making sure that this does not become a precedent and that maybe other agencies could use our help as well? Just your thoughts on it.
Yeah, no, I appreciate the question, the inquiry. And specifically to answer your question, no, I didn't have any conversations about this at the World Health Assembly. But what we did do is begin the relationship development with other nations around the world that are leaders in the area of healthcare and global health security. And so I look forward to gaining this information, getting up to speed on it, and taking this information to other nations who are leaders in the World Health Organization, so that we can respond to you appropriately.
I appreciate it. I yield back. Thanks, Mr. Chairman.
Thank you. Ms. Delbene, you're recognized.
Thank you, Mr. Chair. Thank you, Mr. Secretary, for being here with us today.
Thank you.
Mr. Secretary, in less than 6 months, this administration has already been devastating for Americans' health. This administration's created chaos, confusion, instability in the market, and that has dramatically increased health insurance costs and leaves the middle-class families to foot the bill. This administration has taken steps to allow states to kick new mothers off of Medicaid if they can't find work within 60 days of giving birth. This administration is rolling back protections for women by allowing employers to deny a woman access to birth control. This administration is pushing a dangerous health care bill that allows insurance companies to again discriminate against people with pre-existing conditions. And now, your department has released the worst budget for women's health in a generation. Not only does it advance dangerous policies to impose a pregnancy tax and gut health coverage for maternity care and breast cancer screenings, not only does it decimate the Medicaid program, which provides health coverage to 1 in 6 women, but for the first time in history, it also takes the extreme step of defunding Planned Parenthood, a trusted medical provider for 2.5 million Americans that performed more than 600,000 breast and cervical cancer screenings just last year. The Congressional Budget Office, I hope you're aware, the Congressional Budget Office has estimated that nearly 400,000 patients served by Planned Parenthood would not find alternative care through community health centers and other providers. And I hope you're also aware, Mr. Secretary, that the CBO also estimates that defunding Planned Parenthood actually increases the nation's deficit by $130 million over the next decade. That means costing taxpayers more money and denying women health care. And that's something that my colleagues have brought up in terms of making sure that we look at the numbers. That decision would increase the deficit. The CBO's rationale is that Planned Parenthood helps women plan their families, and by denying them access, there will be thousands more unintended pregnancies in the Medicaid program. People across the country oppose this. They oppose this kind of attack because they know politicians have no right to interfere in a woman's personal medical decisions, and that includes decisions about where and when to get health care. So I would strongly encourage you and President Trump to reconsider this reckless and misguided effort. Family planning should not be a partisan issue. Democratic women, Republican women, independent women all rely on contraception and family planning to decide the course of their lives and choose when or if to have a child. It's time for this administration to stop the relentless attacks on women and families. We deserve better. And I yield back.
Mr. Meehan, you're recognized.
Thank you, Mr. Chairman, and thank you, Secretary, for being here today. We are very grateful to see your presence at what is most possibly the second most watched hearing today in Washington, D.C.
Or lower.
But in any event, I want to start by thanking you for the work you're doing on opioids. Second, thank you for the work that you're doing on increasing the cybersecurity associated with the medical records, and we're going to need that kind of leadership on a very, very vital issue. There are two other sort of issues. One that I believe you have always been a proponent of, looking for ways that we can continue to improve quality while looking for ways to control costs. And one of those has been movement away from the fee-for-service model and looking at experimental plans in which we can reward those who deal with payments that work on prevention. Once we get into models like that, there are laws that have an impact that may not make as much sense. And I speak specifically to the Stark Law and the law that deals with anti-kickback. They had a very valid purpose at one point in time, but may not have the same applicability if we are dealing in the context of collaborations on preventative care. You as a physician know sometimes it makes sense for a doctor who's not going to be rewarded for the number of times they use it to have access to testing. So if we can find ways to look at these kinds of experimental programs, will you commit the willingness of the agency to consider whether we should be looking at things like Stark and anti-kickback as whether there's space in there for some changes? And then I would like if you could also continue to pay attention to an unresolved issue about clinical laboratory payment reform. It's a small issue but important because you may recollect there was a requirement for data regarding the definition of applicable laboratories and also issues regarding data reporting and collection that have had difficulty in being computed because the actual response mechanisms weren't in place. And this deadline of March has passed, and these clinical laboratories are still in a situation in which they don't have the appropriate guidance. Anything you could do to continue to look at that issue, I'd be grateful for.
Yeah, thank you very much.
Thank you. Ms. Chu, you're recognized.
Secretary Price, as a doctor, you swore to first do no harm, yet you are here to defend this budget, which will do untold harm. This is a budget that embodies cruelty. It takes an axe to programs that assist our most vulnerable families, like Meals on Wheels, just to give $1 trillion of tax breaks to the wealthiest few. There are many who lose out on this budget, but I want to take a moment to talk about what this budget will do to people living in my district and to women in particular. I note that this morning you actually said to the Senate Finance Committee that the president's budget would provide for an increase of Medicaid. It is an unbelievable statement. The truth is, along with Trump care, your budget cuts Medicaid by $1.4 trillion. You will force states like California to choose between long-term care for seniors and providing health care for children. And in my district, 20% or nearly 150,000 people will suddenly be at risk of losing health care services. And that's on top of all the ways this budget goes above and beyond to harm women. Medicaid accounts for 75% of all publicly funded family planning services, but you cut Medicaid by over $1 trillion. In California, half of low-income women of reproductive age are covered by Medicaid expansion, but you completely gut that through the Republican budget and Trump care. Without the opportunities to make their own health care choices, women around the country face a return to the last century where reproductive choice was reserved for the select wealthy few. Moreover, Medicaid funds almost half of all births in the United States. So not only are you cutting the program that helps American women choose when to have children, you're making it more difficult to access maternity care when their children are born. And in fact, Trump care further harms pregnant women. The independent CBO specifically calls out maternity care and says that insurers will no longer cover maternity care in states that get rid of essential health benefits. And the options for women in this budget only get worse from there. This budget completely zeroes out the teen pregnancy prevention program, which is incomprehensible to me. Because of programs like this, teen pregnancy has decreased by 55% in the last 20 years. In fact, without publicly funded family planning programs, the teen pregnancy rate would be 73% higher than it is now. And just last week, we saw through a leak that this administration seeks a final rule to make it easier for an employer to deny their employees access to birth control. Incredulously, this regulation suggested that women whose medical choices were vetoed by their bosses could seek family planning services from Medicaid. But remember, your budget cuts Medicaid by $1.4 trillion. This budget has little for those who are not already rich. This is not first do no harm, but rather first harm those in need.
Thank you, Mr. Curbelo. You're recognized.
Thank you, Mr. Chairman. Welcome, Secretary Price. It's good to have you back here in the Ways and Means Committee room. As you know, I represent South Florida, specifically the Florida Keys, which is one of the most beautiful parts of the world, but it's a county where residents who don't have employer-based health insurance or government-sponsored health insurance have one single insurance provider. That means no choices for the people of the Florida Keys. Like so many Americans, they have become accustomed to higher premiums, fewer choices, and lower quality. So I certainly support the idea that we need a better health care system for our country. However, while Congress considers what that new system will be, I do think we need to protect the most vulnerable. And I'm glad that this administration has committed to funding the cost-sharing reductions that are dedicated to supporting Americans who would have a lot of trouble accessing the health care system but for them. And I'd like to encourage all of my colleagues here in the Congress to follow that lead and to support, during this transition period, funding this important program. Also, Mr. Secretary, I wanted to bring up the National Institutes for Health. As you know, South Florida was hit hard last year by the Zika crisis. Obviously, it was a public health threat. It was also an economic threat to our community. Can you commit to supporting the NIH and all of their efforts in research, in vaccine development, to make sure that if the threat of Zika returns, which we are nearing the season, that our government is prepared to support communities like South Florida and others throughout the country that are exposed to this threat?
Yeah, thank you. Because of the resources that Congress has provided, a significant resources have gone into the production of the discovery and production of vaccine for Zika. We're in phase 2B trials, as you likely know. Very exciting time, and we're very hopeful that we'll be able to bring that online rapidly.
So you can commit that all of those programs, all of that work that's being done is going to continue for the foreseeable future?
Absolutely. It's a priority of the department and of the NIH, and it's a priority of the administration.
Thank you very much, Mr. Secretary. I yield back, Mr. Chairman.
Well, thank you, Mr. Curbelo. Without objection, I'd like to enter into the record a report by the American Action Forum that shows that 5.3 million Americans will be eligible for help with their premiums under the Republican health care plan than are currently assisted or eligible under the Affordable Care Act. Mr. Secretary, I'd like to thank you for appearing for us today. I know it's been a long day, and appreciate.
Mr. Chairman, excuse me. I've not had an opportunity to speak.
Well, yes, Ms. Sanchez, you're recognized.
Thank you, Mr. Chairman. And Mr. Secretary, thank you for taking the time to appear before the committee today.
Good to be with you.
Frankly, I'm baffled by how administration officials such as yourself can continue to publicly state that the Republican health care bill and Trump administration budget does not cut Medicaid spending and that people will absolutely not lose coverage. These statements simply do not line up with the scientific calculations made by the Congressional Budget Office. In fact, the CBO found that 23 million people will lose coverage, including 14 million fewer Medicaid enrollees. These calculations also include a cut of $834 billion in federal outlays for Medicaid. On top of all that, the fiscal year 2018 Health and Human Services budget put out by the Trump administration slashes another $610 billion from Medicaid for a whopping total of $1.4 trillion. Despite these cuts, administration officials and congressional Republicans continue to claim that the Medicaid population will be cared for in a better way under our program, and that Medicaid spending under the proposal and under the budget goes up every single year. Interestingly, the poor and the disabled aren't the only Americans that the Trump administration is leaving out in the cold. The AHCA hits seniors by cutting short the solvency of the Medicare Trust Fund. The Trump budget cuts the Temporary Assistance for Needy Families program, which helps working families afford child care. What kind of voodoo math are you using to justify your statements claiming to help Americans when you're taking over $1 trillion out of the system to pay for tax cuts for the rich? How are we supposed to believe administration officials about what impacts these proposals will have when they themselves have abused their power to increase their personal wealth? For all the cries about the CBO score, Trump officials sure know how to make accurate calculations when it affects their bank accounts. The truth is, the Trump administration can't justify their numbers when it comes to protecting the American people's bank account. Instead, they resort to attacking career officials or undermining the very people they appointed to do the jobs they've asked them to do. I simply don't understand how you can continue to perpetuate these myths that people will not be harmed under the Republican health care bill. But I do want to follow up on something that Mr. Curbelo said, that the administration has agreed to fund CSRs. Can you please confirm that that is true, that you will pay insurers?
As I said, I'm the defendant in the case, House v. Price, and so what I'm able to share with you is what's in the budget, and that is that the budget reflects that CSR payments will be made for the next 2 years.
Thank you, and I yield back my time.
Thank you, Mr. Secretary. Again, thank you for being here today. We look forward to working with you on a broad range of health care issues and reform issues. We can do much better than health care that too many people in Obamacare are trapped in today. As you know, as a former member of the committee, you know members have 2 weeks to submit written questions to be answered later. In writing those questions, and your answers will be made part of the formal hearing record. Again, thank you, Mr. Secretary, and with that, the committee stands adjourned.
Thank you, sir.